Well, the Medicare annual election period is finally here, and I'm going to be discussing Medicare Advantage plans for 2025. Now, perhaps you're enrolled in a Medicare Advantage plan now, and maybe you got that letter in the mail stating some of the benefits are changing, or perhaps the plan's leaving your area entirely. That's happening quite a bit. Maybe you've got a Medicare supplement plan and you want to try a Medicare Advantage plan for the first time. Well, I'm going to be discussing the four main types of Medicare Advantage plans for 2025, as well as an easy way to compare plans side by side and even enroll online yourself if you want to. Stick around. My name is Russell Noga with Medisupps.com, and for the last 16 years, we've been helping people with their Medicare insurance, be it a Medicare supplement plan or Medicare Advantage plans. Now, in 2024, there were 43 different Medicare Advantage plans for the average person to choose from. It gets very confusing, so you need one central spot where you can go and get all the help you need, which is why I've created a very unique website to allow you to shop and compare Medicare Advantage plans for the comfort of your own home. To do that, you can visit our website, which is CompareMedicareAdvantagePlans.org. CompareMedicareAdvantagePlans.org, and that link is in the description below. What this allows you to do, simply enter your zip code. We don't want any other personal information. You won't get hounded by anybody. But the zip code allows us to filter the plans that are available in your area, and you can see the benefits and the cost of each different plan. You can also see if your doctor accepts the plan. This makes it very, very easy to shop and compare, and you can even enroll online on your own. However, if you do need help, we've got a chat feature as well as a phone number where you can call, speak to a licensed agent to easily walk you through once you do find a plan to fit your needs. Now, Medicare Advantage plans in 2025 are offered by private insurance companies, and what these plans do is they're an alternative to Original Medicare. And Original Medicare consists of Medicare Part A, which is hospitalization coverage, as well as Medicare Part B, which is your doctor's services. Medicare Advantage plans may offer some additional benefits. You may have seen those advertised. However, they're not required to. And these plans are different by not just coverage, but area. So each part of the country has different plans. That's why if you talk to a relative or a friend some other part of the country and they say they really like their plan, it might not be available in your area. So these plans are different. They may have different benefits. Therefore, you need to shop and compare all the plans available in your area to see which one fits your needs. So who qualifies for a Medicare Advantage plan? Well, anybody who's enrolled in Original Medicare, Part A and Part B, can opt out of that and enroll in a Medicare Advantage plan in 2025. Now, Medicare Part B does have a monthly premium. You will continue to pay that even if you do decide to enroll in a Medicare Advantage plan. Many people have this premium coming out of their Social Security check, automatically deducted each month. It will continue to do so if you decide on a Medicare Advantage plan. Now, let's talk about the four different main types of Medicare Advantage plans offered in 2025. They are an HMO, which is a health maintenance organization, PPO, which is a preferred provider organization, SNP, which are special needs plans, and PFFS, say that 10 times fast, private fee-for-service plans. Each of these varies greatly depending on the benefits and the networks and the details of using those networks. So just talk about the HMO and PPO right now because those are the most popular, and you can decide which one of those might fit your needs a little better. So an HMO and PPO are in fact different. On an HMO Medicare Advantage plan, you will choose a primary doctor and you will have a network. You will have a network with a PPO as well. But in the HMO, you're required to get your coverage within that network unless in the case of an emergency. If you decide to visit a doctor, specialist, or any provider outside of the network, pretty good chance they're going to charge you full price for it. So with an HMO, that is one of the main differences is you are required to stay in network. Now with that primary doctor that you choose, you will also need a referral from that doctor to see any specialists with an HMO. And one of the benefits of an HMO may be what's called lower max out-of-pocket costs, which I'll get to more in a minute. With a PPO, a preferred provider organization, you can see doctors in the network or outside of the network. Big difference from HMO. Now, the cost may vary if you do see a provider outside the network. In-network costs typically are lower. That's why they have the network. And it's not likely that you'll need a referral to see a specialist. In regards to a primary doctor, well, you can certainly have one, but you don't need to designate one in a PPO. So a lot of people prefer this option because they can actually see docs outside of the network, it really opens up your opportunities. However, it all comes down to the network, which doctors accept which insurance company, and the costs and the coverage of each plan. Now, earlier when discussing HMOs, I mentioned what is called a maximum out-of-pocket cost, and this applies to both HMOs and PPOs. This is an amount that applies to Medicare Advantage plans that once you meet this amount, after that, the insurance company pays 100%. You're no longer required to pay anything. And all of your expenses go towards this amount. That would be maybe premiums if you've got them, or deductibles or coinsurance. And different plans have different max out-of-pocket expenses. I mentioned an HMO might be lower. Another benefit of using our website, we show all of those of each plan, what your maximum out-of-pocket expense will be. And again, once that's met, the insurance company will come in and pay 100%. So aside from just choosing an HMO or a PPO, there are other factors involved, and those include costs. Those could be deductibles, premiums, copays, coinsurance that are associated with each plan, and you do need to know those, as well as if your doctor even accepts a plan. And again, an easy way to do all that is to visit our website, compareMedicareAdvantagePlans.org, or click the link in the description below. We'll take you right there. The plans will begin displaying on October 1st. There, you can find a plan that meets your needs the best, enroll online yourself, or get expert help from a licensed insurance agent if you need it. Thanks for watching.